Okay, so just to get us started, we're 11th graders at a science and tech-based high school in the U.S. My name is Derek.
Okay.
My name's Chatham. We're going to be telling you about our healthcare research project.
Okay.
My name is Caleb,
Yeah,
and
my name's
I'm also working with Derek and Chatham for this research project.
yeah, my name's
Okay.
Finnegan, and I'm working on designing engineering solutions for problems with the Nigerian healthcare system.
Okay.
And to preface, we're researching the healthcare system to build a deeper understanding of like the workings and more unseen side of this industry, as most of the current info available on the topic is either biased or outdated. We're writing a research paper to finalize all our results, and we chose to interview people from all sorts of diverse backgrounds and from different regions, as we hope to gain different viewpoints instead of
Okay.
just one source. Again, thank you for your participation.
You're
And
welcome.
Yep, thank you. All right, chat for me. I'll start off. Ours.
Yeah, so we have some preliminary questions we want to ask you. If you don't feel comfortable answering one of them, just tell us and we'll skip past it.
Okay.
So what region of Nigeria do you live in?
Okay, Lagos.
Okay. Do you have any family or children that you live with?
Yes, I have children. I have a husband and two children.
Okay. Describe the type of community you live in. Is it rural, urban, or
No, no, it's urban.
okay? And then what is your main occupation?
Okay, I'm actually a stay-at-home mom, but I do business on the side, so that's
Okay.
it.
And then around like what general age are you? You don't have to tell us your exact age, but
No, no,
uh,
it's okay. I can tell you my age. It's okay. I mean, it's a research, so there's no problem. I'm 40.
okay, thank you.
You're
And
welcome.
then Derek, do you want to start on the informational questions?
Yep, sure. Okay, so let's get started. Tell us about your like general experience with the healthcare system in Nigeria.
Okay, so in Nigeria, we have two types of healthcare system. Well, I don't really know the ones you want to know about because we have the private sector and we have the government sector, and I have used the two of them. So, which would you like to know more about?
If we could know about both, that would be pretty good because we are trying to just get a broad overview on the entire healthcare industry and ways it can be improved in Nigeria.
Okay. So, what you really want to know is the ways that it can be improved, the healthcare system, right?
Yes, ma'am.
Yes.
Okay, all right. So I'll start with the private sector, okay? And the reason why I'm starting with the private sector is that the treatment is better. When I say treatment, I don't mean the treatment of the illness, but in terms of the way they relate to the customers. And that's because you pay more than the government. So let's assume you get into the hospital, the reception, right from the reception, the nurses, they are warmer and they attend to you in a friendly way, even though you get to pay more. But for the government sector, okay, they are not so friendly. People are usually more, they have so many patients to attend to, and the wait time is longer. Unlike in the private sector, you get to spend, say, 10 minutes and you can see a doctor, someone who's going to attend to you. But unlike in the public sector, you have to wait until it's your turn. So if you get there and you meet 30 people, they attend to those 30 people before you eventually get attended to. So it could take you the whole day just to see a doctor. But though it is cheaper because there the drugs are subsidized. and you just pay for a card, and the card is very cheap. That's all. And also, they have more professional doctors than in the private sector. So, briefly, in summary, that's what I can say about it. But if you have questions, you ask me and I'll answer.
So specifically about the availability of these different systems, would you say that public or private would be more accessible? And like, for example, the concentration of how many of them? Are there more hospitals that are public than private, or vice versa?
No. There are more private hospitals. Like, I'll use my environment as a case study. Okay, there are more private hospitals here than government, because the government hospital, they attribute it to just one area. Like where I am now, though I said I'm in Lagos State, but I am in Idimu in Lagos State, and that's an area in Lagos State. So one hospital per area. So there are other areas in Lagos State that have their own government hospitals. But for the private, you can have 6, in fact 20 in just this area that I am in.
Thank you. And also, so how do you typically get information about these treatments? Like, for example, if your child was sick, how would you, what's the process to get treatment in?
Okay. The first thing is you must have something, like we call it like an account. You should have an account with the hospital. So let's assume you do not have an account. Let's say you need to get treated and you walk into the hospital. The procedure is you request for a card, and that card you need to pay. So for in the private hospital, it's about say $2 to $3. But then again, it depends on the kind of hospital. There are some, for the privates, there are some that are more expensive than the others. But here, the private hospital I use, it's about $2 to $3 to get that card, first and foremost. Then in the government hospital, it's about $1 to get the card. Now, when you get the card, you can now see the doctor. When you get to see the doctor, and the doctor gives you your drugs, he prescribes drugs for you, you go to the pharmacy and pay. Now, this is where the difference between the government and the private is very visible. In the government hospital, the drugs have been subsidized, so you get to pay way less than in the private. You can pay as much as times four, because they are not subsidized for the drugs. So that's just the way it works.
So when you're getting your prescription drugs, is it similar? Does the government hospitals have less supply, or is it just the overall quality of service is lower that are causing people to use private hospitals instead?
Okay, now the reason why people prefer, there are so many reasons why someone could go to the private over the government. Now, we also have what we call HMO. HMO is an insurance where your bills are being paid for by your organization. So some people in their offices, they offer them HMO services. So they can choose to use the private hospital. Like I said, their services are way better than the government. There's less wait time. Reception is better. The way you are attended to is better. So you could choose to use the private hospital. But then there are some people who prefer professionalism over the other benefits the private hospital can offer. Like I explained earlier, the government hospital, they have more experienced doctors. So some people, even if they can afford the private hospital, they will prefer to use the government hospital, because they believe that they're going to get better they're going to get better professionals from the government hospital. Do you understand?
Yes, ma'am. I have a question. How common is it
Okay.
to use the private hospital versus the public hospital? Which one is more commonly used?
The government hospital is more commonly used. Like I said now, if you go to the government hospital, you see a lot of people, like you can see over 50 people there. But if you go to the private, you see maybe 10. You can't even see up to 10 because one, they respond to them immediately, like, and they have doctors too, and they respond to people quickly. But the government hospital, there are a lot of people. And another thing I need to mention is that the government hospital have more specialists. Like in the private hospital, you may not get to see an in-house gynecologist or pediatrician, but in the government hospital, every specialist is there, every specialist under the medical line there. That's another major difference. Many private hospitals do not have specialists. They could even tell you that their specialist comes only on certain days, like say, oh, only on Wednesdays can you get to see, say, a cardiologist. But in the government hospital, they are always there. The cardiologist, the pediatrician, gynecologist, everybody is there. So that's another thing. And that was what I said, that they have more professionals than the private sector. So some people may decide to go to the government. Again, I'm saying it, even if they can afford, they have the money to pay the private hospital, but they don't believe that they can offer them the kind of service that they need. So they would go to the government hospital, even though services are not as friendly as the private. So that's another reason why they would choose the government they will choose the government over the private. But there are some very standard private hospitals that do have the specialists, but of course they're going to cost a whole lot more than the average I've stated. We have exclusive private hospitals, but they will be very expensive. But you can find all specialists there too.
Around how much more does a private hospital cost compared to a public one?
Okay, so there are different types of private hospitals, and they all have different standards. On the average, say an average hospital costs about 3 times more than the government. But then there are some exclusive private hospitals. They could cost maybe like times 15 than the government hospital. Like we have some highbrow areas. Hospitals in those areas will cost a whole lot more than the government.
Okay, thank you. My next
Yeah.
question is, we had an interview our last interview, they said that they're lacking certain resources in the public hospital. Like they don't
Okay.
have vital monitors and like they don't have as many ambulances to transport people. Is this true?
Okay. Well, I haven't really used that service, so sincerely, and I don't want to give you information based on hearsay because a lot of hearsay goes on. People will say all sorts of things. If I am not in the position to clarify that, I would rather not confirm. So I haven't had the need to use an ambulance. I can't say. But yes, I do hear that they lack some of those things, like ambulances are not available, or some would say certain things are lacking in the government hospital. But I haven't used those services, so I can't confirm that. It is the ones I have used. Like for every time I've taken my children to see a pediatrician, they have been attended to. So that's what I can confirm to you.
Okay, thank you. I have
You're welcome.
another question. What specialist would you say is the hardest to get a hold of, or the hardest to get in contact with, or get an appointment with?
In general or in private or government? Which one?
In general.
In general, well, hmm, I can't really say, but for in the general hospital, like that's we call the government hospital the general hospital, all specialists are there. All. I wouldn't know if there's any other complicated medical term that I do not know of, but if you mention all the kinds of specialists, I'll tell you they're there. But if there's any particular one you want to ask me about, you can ask me and I'll take notes and I can call them to find out if they have that kind of specialist there. That is after our phone call. I can find out for you. And I can also call the private too and find out if they have that specialist. But to the best of my understanding, the government hospitals have almost all kinds of specialists.
Okay, thank you.
Welcome.
Another question. Let's see. How do you typically get information about healthcare or like available treatments? Where would you find that?
Okay, there are available treatments, right? That is, if I want to see, say, a specialist to find out if they offer that kind of service, right?
Yes.
Okay, so if it's the private sector, their customer service is better. You could always pick up your phone and ask them. But for the government, you need to go there physically and find out.
My next question is, how common was telemedicine and like phone calling or Skyping a doctor professional during times like COVID where you it was less likely to go in person?
Again, that's something that I didn't really experience, even though they said it was available. What you mean is, like, instead of going to the hospital physically, you could consult a doctor online, right?
Yes.
Okay, I can't really say about that because I didn't use that service, even though it was available. And I really don't know if who or people close to me, none of them said they used that service. So I can say, if but you are talking about during COVID, but what about now? Would you like to know about now?
Yes, that would help.
Yeah, it's available now because I do see apps that offer such services. So I can say that, yes, I know about now. It's available, but back then I can't say. During COVID, I can't really say.
Okay, thank you.
Well,
Have you seen any corruption or unethical practices in the healthcare system or in general hospitals?
okay, yes, it happens. Like I did mention that sometimes when you get there are so many people. But if you like if you tip someone, probably their receptionist, you get to see the doctor on time instead of waiting for every other person. So you become a priority to them. So that's one corruption that goes on there.
Okay, so you can like skip the waiting line depending on how much you pay.
Yes, 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 you can. You can.
Hmm. Okay. We wanted to ask about culture and how it affects people's interpretation of healthcare.
Okay.
So, do certain people choose to use like um m- choose not to go to hospitals because of culture or like beliefs?
Yes, yeah.
Can you tell us more about that?
Okay, yeah. Culture, like before medicine became something that we're all used to, our culture, sometimes they feel that you don't need to go to the hospital. We have herbs that you can use at home and you feel better. And yeah, there are actually herbs that maybe if you have a headache, you use herbs and you feel better. Or some pregnant women don't go to the hospital because they believe that they can consult someone like a midwife, who's going to help them deliver their baby. And yes, it has to do with culture because they'll still use their herbs to create some concoctions. And for some people, it actually works. So yes, it happens that way. I don't know if that answers your question.
No, that answers it. Thank you.
You're welcome.
How close is your nearest private hospital compared to the public one or general hospital?
Okay, so I am unfortunate to be in a place where they are both close to me, both the private and the hospital. They are close to my residence. But for some other people, they may have private hospitals. What I've seen is in fact, in this everybody's neighborhood, there is a private hospital, or even if it's a clinic, there's always one in around them. But for the government hospital, it's always situated in just a location. So it's closer to me, but it may be farther off to other people.
Okay, because you mentioned earlier that there's more private hospitals, so it would be more common to be closer to a private hospital, right?
Exactly, yes, yes. You will always have a private hospital closer to you. No, there's just no way you won't, no matter where you are in this area, there's always a private hospital. Even if it's a clinic, there's just one somewhere.
Does that make it more common? Wouldn't that affect how common it is to use private hospitals? Because people, it's more accessible that way. It's closer
Yeah,
to your house.
that's what I said, that the for the private hospital, and then I did mention that there are different grades or standards. Let me say standards of private hospitals. Some are not up to standards, like you might see clinics or even a private hospital who don't have specialists. Like the private hospital I use, they have specialists there. So it's a very standard private hospital, but it's just that it is more expensive. So if, okay, like I'll give you a real life scenario now. For the private hospital to see a specialist, to see a pediatrician, it costs you 20,000 naira per consultation. That is just one time visit to take your child to the pediatrician is 20,000, and that 20,000 naira translates to about, say, I think $10, if I'm not mistaken. But in the government hospital, it's free. You do not pay to see a specialist. The only thing you need is your card. And once you have your card, you get to see whichever specialist you need at that point in time. So these are the factors that determine which hospital you go to. So for me, if I am financially buoyant, we go to the private because I want to enjoy good customer service and I do not want to go and wait because I know many people are going to be many. So I go to the private. But if there are periods where I'm not too financially okay, then I have to consider the government hospital because I know we are not going to pay to see a specialist. So is that analysis clear?
Yes,
Yes.
that's clear. Thank you. So, has, for example, during COVID-19 pandemic, how was the availability and utilization of the hospital, such as like vaccine availability and stuff like that?
Yeah, yeah. Like you, what you are asking is how were the treatment? Is that what you're asking?
Yeah, during like busier times, how was the utilization and the treatment quality? Did it maintain consistent or did it
Yeah, yeah.
drop?
In fact, I was impressed based on what I read. Again, I reiterate, I didn't get to use their services at that point in time because I didn't need to. But what I read online, pictures that I saw, people said they were attended to properly. Although there were some complaints in the isolation centers, where people that they were actually confirmed to have COVID in the isolation centers, there were complaints that they weren't properly attended to in those centers, they weren't given food, things like that. But the treatment in the hospital, like not even the treatment, no, the way they were receptive to patients, people who came in, it was impressive. It was. But I did not have a personal experience.
Thank you. That's good to hear. Also, so regarding support for people with disabilities, like people in wheelchairs, how accessible would you say the area you live in is? For example, wheelchair ramps, crosswalks, stuff like similar to that.
Uh-uh. No, Nigeria has not really made people living with disability, they haven't really created a convenient atmosphere or environment for them, and that is the truth. That's the truth. Even the way fellow Nigerians behave to them, they don't treat them well. They look down on them. They don't realize that they really had nothing to do with the way they are. They don't really even treat them with kindness. They kind of look at them in a condescending manner. So there are no roads for them, no special roads. But in the banking hall, they have wheelchair ramps. Even in the hospital, they have where they can easily wheel their chair. They have that. But on the major roads, nothing like that.
Okay. Thank you. And how is the like since all of this is about more the physical aspect of healthcare, how is the mental health care and different kinds of support and services available, or does it not exist?
Okay, for new mothers, right?
Uh, like in general, but
Okay,
We're
okay,
talking about when it comes to mental illness.
okay, you are talking about mental illness.
Mm-hmm.
Okay, how they are being treated.
Yeah.
Okay, again, I'll have to say this. I don't have a personal experience on this, so you guys are using this for research purposes, so I want to give you the best kind of information that I can give as possible. I don't want to give you based on what I have heard. So I don't have a personal experience. I haven't even been to a psychiatric hospital, so I do not know how they are being treated. That's just the truth. I can't say.
and how's the support for mothers as well?
Okay, the support for mothers, it can. I mean, there's room for improvement because I am a mother. I have two children. I know all that I passed through. And I know that it's a very delicate period in any woman's life. Every woman needs support, special support, not just any kind of support. But in the hospitals, they no big deal to it. They act as if, hey, I mean, you are here to give birth, and that's it. A few nurses are compassionate, but overall, they do not really have that compassionate side. They just like give birth and that's it. Some if in the government hospitals, some people even say new mothers that they get yelled at, maybe when they're acting kind of dull, like maybe the way some women feel when they have a child, instead of the nurses to even be sympathetic, they sometimes yell at them. That's all. But for my own experience, I gave birth in a private hospital. I can say they were just okay. I can't say they were very good. They were just okay. I'll rate them. If I'm to rate them, I'll rate them say 5/10 in the way they treated me, someone who just gave birth. That's the way I'll rate them.
Okay.
Okay. Thank you for your input on that. And
Yeah, welcome.
how do you think the government, in what ways, like in your opinion, do you think the government can improve the quality of healthcare in Nigeria, either for the public hospitals or private, like all of it?
Okay. For the privates, they could try to assist them with maybe some money. They could try to subsidize their drugs so that if they subsidize their drugs, people would feel more inclined to go to the private hospitals because they know that they are not going to pay so much. Then for the government sector, sincerely, the government sector is trying. They are trying. Just that, yes, currently Nigeria has so many issues. So it's kind of difficult for them to do much more than they are doing. But the customer service in the government hospital that I use, it has improved a whole lot. The way they treat people who come. Before they used to be kind of very indifferent and in fact almost insultive, but now they attend to us in a better manner. So the ways governments can improve services at the government hospital by, number one, increasing their salaries, because I feel someone who earns very well will be happy to come to their jobs and will be happy to treat people well. But when they are not being paid properly, they feel disgruntled, and that automatically affects the way they respond to people. Then, too, sorry, there's something I need to um, make mention of. This is an improvement too, because before, in the government hospital, when you go to the government hospital, you see the doctor, you wait for your turn to see the doctor. But now you need an appointment to see the doctor, as long as it's not an emergency. So that way they have kind of reduced the workload for the doctors. And this is because before, when you come to the hospital, even if 50 people come to the hospital, or say 100, the doctors must attend to those 100 people. But now, by saying you have to make an appointment, the doctors now have a number of people they attend to daily. So that has reduced their workload. And by reducing their workload, it has increased the quality of the service of the doctor. Because when the doctor has less people to attend to, they will attend to you properly. Unlike when there are so many people, they rush, they may not listen to you, they just want to get across to all the people that have come. But now you go to the hospital first, you make an appointment, then you come on that appointed day. So that day, the doctors know that they are going to attend to maybe only 20 or 30 people. So that is an improvement from the government. Another thing is they could get more doctors, more specialists, so that they can attend to the volume of people that come. Because regardless, no matter what, there are still so many people in the government hospitals than the private. I have the choice, I can choose, but there are some people who do not have that choice. They cannot afford the private hospital. It is not a matter of, oh, I have money today. They don't. They are low income earners, and because of that, they can't afford the private hospital. So they are always going to use the government hospital. So the government can increase the doctors, they can increase the number of doctors they have at hand, they can increase them. But booking the appointment thing has really reduced their workload. So it has allowed them to attend to patients better because they now have more time. Those are two areas that I think they can. And what else? Basically, I feel that increasing their salaries and getting more doctors would improve the treatment at the government hospital.
Uh, Thank you.
You're welcome.
Are there any technological innovations you think can improve in healthcare in Nigeria?
Are there technological innovations that what?
That could improve healthcare in Nigeria.
That can improve. Well, you mentioned telemedicine, right? That could improve because sometimes the diagnosis can be done by just speaking to a doctor. So the government can actually incorporate that idea into the government hospital. They could have a section for that where people can call in and they can get their diagnosis on the phone. That is even good because it reduces the number of people who come to the hospital. Number one, it reduces the workload for the doctors. It's just like our banking system before. In the banking hall, there used to be so many people wanting to withdraw money, deposit, but now with the ATMs, we have ATMs and we have local POS. So people hardly go to the banks these days. You can just do it around. And again, there's something I need to mention. Government later introduced a lower tier than the government hospital, and we call those ones health centers. Health centers are in every neighborhood. Every neighborhood. What they do is they do immunization for children. So that has also reduced the workload, only that they do not have specialists. You can't see specialists in the health centers, but the health centers were created by the government, and they are in every neighborhood, every neighborhood, they are there. So people can go there, but basically they are used for immunization, but they have doctors there. So if it is not a serious illness, someone can also go to the health center.
Okay. Have you ever encountered any misinformation or myths about your health and illness in your community?
No, I haven't. Not even for my kids. I haven't.
Uh, like what are the biggest health challenges, and do you believe there's enough awareness and education about these challenges?
Okay, sorry, can you come again?
What are your biggest health challenges in Nigeria, and do you believe, or not Nigeria, sorry, but and do you believe there's enough awareness and education about these challenges?
Okay, let me see, I think I don't really get your question, but I'll try. You said,
Can
are
I
there
try to
any
reiterate?
health challenges that are misunderstood or what? Sorry, can you repeat yourself?
Most
What?
common health challenges in
Okay.
Nigeria.
Okay, the most common health challenges in Nigeria.
Yes.
Is that what? Okay, then that should be malaria.
And then how is it being dealt with, and like what can be improved?
How is it being treated?
Yes.
Okay, so for malaria, most people, I would say 70% of people do not bother going to the hospital. They diagnose themselves because the symptoms are pretty easy to detect. And the way malaria starts is once the person has a fever above 37 degrees, they go to the pharmacy and they get over-the-counter malaria drugs, and that's it. Most people do not go to the hospital because it is prevalent. It's something that so many people have. So we are already used to the symptoms and we already know what medication to use. But some people take it a step further by going to some laboratories and carrying out tests. When they carry out tests and they find that they have malaria, they feel there's no need to go to the hospital again. Just get yourself your malaria drug, and after 3 days, you are better.
Okay. Um, how do you think the healthcare funding and resource allocation could be improved in Nigeria?
Okay. For the funding allocation, I really can't say how it is being done presently. But of course, in many sectors in Nigeria, corruption is a big problem. So they may just need to get more um, financial crimes agencies to carry out investigations and ensure that the money is being disbursed properly. Do more investigations to ensure that allocations are done properly. That's it. But it's just that almost every sector in Nigeria is rotten. So I really don't know if the government is interested in doing that. That's what I can say.
All right. How does the healthcare system cater to the needs of the elderly population?
How does it what?
How does it cater to the needs of the elderly population?
Okay, to the elderly, it's the same process as every other person. They need to go if they feel ill. I don't think there's any special. No, there's not that I don't think there is no special treatment because my dad has had to go to the hospital a few times and there's no special treatment. They go there, wait in line like every other person until they get to see a doctor. That's it.
Um, all right. How often do you go for checkups or screenings? Are these services like easily accessible and affordable?
They are not affordable and they are not easily accessible either. In the private sector, they are easily accessible. Yes, of course, you go there, you go for screening and you get it done. They will refer you to a laboratory because there are some tests that need to be carried out. They refer you to a laboratory, and but for the government, again, you get there and you have to wait in line to get attended to. So it is not easily accessible because the government hospital will always have many people. They will always have many people. So easily accessible rolled out of it. Affordable, yes. Again, it's government, so it's always affordable. So that I hope that answers your question.
It does. What are your views on the National Health Insurance Scheme? Have you or your family ever used it?
No, I haven't. But I've read about it in the news. I've heard about some people who use it, and I think it works. Although there are some allegations. Again, please note, because you are using this as research. This is hearsay. I haven't experienced it. I have heard that there are some treatments that they will tell you that your insurance doesn't cover this. So, for instance, if someone has an ailment, probably needs a surgery, they tell the person that, oh no, we can't, your insurance doesn't cover this. You have to pay for this. So it may not be so effective. But little ailments like malaria, a cold, a flu, typhoid, they treat under the insurance scheme. But once it gets to complicated ones, they tell them that no, we can't cover this. You have to go and look for the money. Or let's say like a woman who wants to deliver and it's via surgery, they say no, you can your insurance doesn't cover this. You have to go and look for the money. So this again doesn't come from me. It's based on what I heard.
Okay. Besides the NHIS, are there other healthcare insurance options available? Are they affordable and accessible?
Yeah, we are there. I think I mentioned the HMO. The HMO is private, and that is an insurance that is being created by some people's organizations. So if they are working, their company decides to give them an insurance package, and there are companies that organize that. They are called the HMOs. So yes, it's it is being deducted from their salary. So affordability doesn't come into play here because it's something that has been taken from their salary, and it covers a lot. Like my sister, when she wanted to deliver her child, her HMO covered the surgery fees, and the surgery fees were quite high. She works in a bank, so her HMO covered it. I don't know if that answers your question.
It does.
Okay.
Um, how do people typically pay for healthcare services when they don't have insurance?
They pay from their pockets, and that's the system for over, let me say, 60% or 70. Okay, let me say 60. I don't have a very, I can't say for sure, but I know that a whole lot of people pay from their pockets for their healthcare services.
Okay. Do you believe there's enough awareness and education about various health issues such as STDs and how these diseases spread in your community?
Yes, I feel that there's enough info. If you are someone who's social media, you're someone who is always on social media, or even watches the television. On the television, they're always passing information. On social media, they are passing information. Even at the local health care centers, you see stickers or posters on their doors. At the hospital, you see posters, and they do go from, sometimes they do awareness, go from school to school, creating awareness or passing information. So I feel, yeah, it could be better, but they are trying.
Okay. How prevalent are lifestyle-related diseases like diabetes, hypertension, and more in your community? Are these an initiative to adjust them?
Is it easy to what?
Are there any
Lifestyle diseases.
like, are there any initiatives or like programs to address this? For example, any like a weight loss campaign or something in the hospital?
Okay, you are asking about the campaigns on diabetes.
Yes, and also how common it is, as well as other like hypertension, stuff like eating too much sugar, too much fat, like that.
Okay, how common are those diseases?
Yes.
Oh, okay, yes. For hypertension, it is pretty common. Hypertension is quite common, and that's due to the stressful lifestyle of the average Nigerian. Diabetes, I don't think that's pretty common. I know, yes, some people have it, but I wouldn't say it's common. But for hypertension, which is high blood pressure, it is quite common. In fact, they say the average Nigerian from 40, they say about 60% of Nigerians have high blood pressure from age 40. So it's quite common.
Okay. How can the healthcare system attract and retain more qualified healthcare workers?
Okay, how they can attract more well-trained healthcare workers. At the moment, I did mention that the government hospital, they actually have professionals. So they do have quality, um they have professional healthcare workers, and I think that they offer them good money. I think they are well paid compared to their private counterparts. So again, money is the incentive. I mean, if a medical student graduates and he gets a good offer in a hospital, that is the first place he will go to. Then working conditions too. They have to have a conducive environment, less pressure. Those are the things that will make them have more quality healthcare workers. And I did mention that that's happening. They are trying to make their working environment more conducive. So for me, those are the things that can help.
Have you so the last person we asked told us that some of these like medical students and doctors are moving abroad to different countries, such as
Yes.
a European country or the U.S. To in search of greener pastures or to find better paying opportunities.
Yeah.
Do you think that's a big problem?
Yeah, it could become a big problem because it will experience what we call brain drain. Like the best of our brains will leave. And the truth is, I really do not think it has much to do with their work. It is indirect, it's just the situation of the country affects them. So what I'm trying to say is, let's say a family unit now, a mother, father with children. Fine, the father is a doctor. The lifestyle of his children and his wife affects his decision to either stay or move. So it may not really be because the hospital he's working, he doesn't like it. No, it's just that he wants a better life in general for his children and his wife. So he feels he has better options if he moves. He feels he has better options as a family. This time around, it's not just about him, as a family. And he feels he has more prospects, so he will move. I don't know if what I'm trying to say makes any sense.
Yeah, it makes sense. Thank you.
Okay, so that's it.
And what roles do you think different government organizations and international organizations do to support and aid the healthcare system in Nigeria?
Okay, based on the news that I read, I see a lot of donations from international bodies. But then again, like I mentioned, the corruption system in Nigeria is kind of deep rooted. How these funds are actually being used, I can't say. Are they properly being used? Are they well utilized? That I cannot say. But I do see donations from so many international bodies say, oh, we are supporting Nigeria with this. Like recently, there was an outbreak of something. Okay, no, it was there was a flooding in a particular state, and I saw some hefty amounts of money being donated, and I was like asking my husband that, are these people actually going to utilize all these donations? The lives of the people affected, are they actually going to be are they actually going to use this money for them? So I can't say, but I know that international agencies are trying in terms of supporting countries like Nigeria, third world countries. I think they are trying.
Thank you. And also for environmental health risks such as like air pollution, water contamination, and poor hygiene and sanitation. Would you say those are like bigger problems or in different areas?
No. No, they are not such major problems. For what could be you mentioned water contamination in my area. I stay in an urban area, so if it is in a rural area, those could be problems. Water contamination, air pollution. Again, this part of where I stay, there are no industries that could contaminate the air. So if you are talking about maybe oil producing, maybe if you get someone who you could ask questions that stays in areas like Port Harcourt, those are oil producing areas. So yes, they could tell you about air pollution, water pollution. Those are things that disturb them because they are in oil producing areas. But I am in an urban area. It's a city. Even though it's a city, we don't really have much air pollution. Even the combustion from cars cannot affect the air. The air is pretty clean. Our water is clean. We have boreholes. Our water is clean. The only thing that could be a problem is flooding, and that is man-made because the gutters can be filled with dirt, and that leads to when there's a rainfall, it leads to overflowing of the gutters, water not being properly channeled. So in this urban area, I could say our challenge is poor drainage, which could lead to flooding.
Thank you. And also for how often would you say do you take your children to go see the pediatrician for checkups?
Okay, so my children are pretty healthy children. I do not take them for regular checkups. I only take them if they are not feeling fine. And so far, the only ailments my children have are the malaria I talked about and infection, then cold. Those are the three things my children have ever been treated for: malaria, cold, like flu, or cough, yes, cough, and infection. That's all. So I don't take them for regular checkups. I only take them if they are not feeling well. Like the first symptom is they run a fever. And if I give them paracetamol and after a day it doesn't subside, then I take them to the doctor.
That makes sense, considering the expenses and stuff like that.
Exactly. Yeah.
Would you say that the health are there health records that are stored, such as your visits to the hospital? Does the hospital keep those records, and do you think they're generally organized or more disorganized?
Yes,
Since
they are very organized. They are very organized. They have computers and every record from your last visit, everything is properly recorded because there was a period my daughter went to the hospital and the doctor asked us to come back for a follow-up. He wanted to know how she was doing. He told us to come back 2 weeks after, but I didn't bother going because I had a very busy schedule. And I went back like 6 months after when she wasn't feeling so well, and he was like, "Oh, you are here now, but you remember that we told you to come like way back then 2 weeks after and you didn't bother coming." So it means that they have good records. If not, he would not have been able to say so. And I was surprised that he remembered, but it was obviously a record that they kept and it showed that I didn't come back. So yes, they keep records.
Thank you. Does anyone else have any questions? Okay. And is there anything else you would like to share with us that you think might help us with our research?
Okay, no, it's just that I would like to know, like, okay, you said you are university students, right?
We're high school students.
Oh, you're
High
a
school
high school
students.
student. Oh, I see. Okay. I just want to know why you're carrying out a research on, I mean, why is Nigeria your focus?
So I've actually done another project in my freshman year, which is ninth grade, about the water pollution and similar to that. Also, me and Chatham, we participated in another program where we called and learned about information and different services in Nigeria. So we already had some pretty good background information about Nigeria, and I interviewed someone from Nigeria one time a couple years ago, so I know that for the most part there's not really a language barrier, so that's primarily why we chose Nigeria.
Oh, okay. All right, okay. That's good. No, I don't really have any other question. It's good. I'm happy that, I mean, Nigeria is your focus.
Thank you. We
You're
appreciate
welcome.
it. Thank you for
You're
your
welcome.
insight. We
Okay.
for sure gained a lot of information. We really appreciate it.
You're welcome.
All right, so that should be it, and I will contact you on Skype afterwards to
Okay.
arrange how you want to receive the incentive.
Okay. All right.
Okay. All right, I'm gonna
Okay. So
end the
I wish you
meeting.
all the best.